UCI TV.
I think another area which requires us to put in more local resources so that we have our own program, not only for the clinician but also for the rest of the other training needs that may come. I don't know whether I've left out any. Yeah, thank you.
UCI TV.
5 gyne-oncologists, so it means one is supervising one, at least one to supervise 3. So for us to increase access, even at the UCI, it means you must employ what is calling special grade in training to become, so those become the medical officers in an institution like this. That's how then we improve the service. Then 2, the other one is just advocacy. I'm also aware that my colleague from Jinja was removed and brought back to the center. Yet he was, I think, doing good work there, not just for gynecology, but generally as gynecology. I think later may know. So 2, I think the local faculty is very important. And why I was asking, what is the senior consultant? What is the consultant in all this? Are these positions filled? Because when you give us, he spoke about something with the collaborations. It means the issues of assuring quality of the program, like for gynecology, are external. So is there a plan to ensure that the person at the level of strategy, because when I look at the program like for gynecology and the other curricula, they are focused around the seniority of these 3 people, the senior consultants, in planning. And so is there a plan to make sure that we have many of our members, I see many colleagues here, who have served quite a while, to reach the level of strategy, so that at strategic level, gynecology is doing well. At that level of pediatric oncology, that level is covered by a senior consultant level person or a professor of sorts. At the level of medical oncology, those are the issues I'm looking at for the long term. But also saying that a level, since you've said you're going for gyne-oncology fellow training, we should not have medical officers in gyne-oncology. We should have gyne-oncologists in training as the medical officers. That will open up more slots. The funding, I think, may even be brought in from within and say, if you're employing 28 medical officers, you have 8 pediatricians in training. You have, I think, 8. You have, I think, 7. That number then becomes the fellows in training.
So we expected one director that the people being mentioned here would be here in person unless they have really serious issues. So that we avoid the problem you hear that in the universities, that you find a very big list and you are corrected, and then after 3 months students are telling us there is no surgeon. And then the council is saying, we are going to set exams, then the university says, no, we don't want exams, and I hear some of you say, we don't want exams, but those are the issues. So head count, because we know we are all staying here, we know who is here. When you say Chiude is here, I know he is here. Then lastly, one director, the fellowship training is very, very serious, maybe sometimes more than MA, because we normally gazette, I will use the word gazette, the trainers. The trainers have to be known. Because for MA, if Professor Maya is not there, the university can get somebody to fill her gap. But if Dr. Moding, the adult oncologist, is not here, a replacement has to be put there immediately, and you have to know it. Because in some other countries, they stop the program if they hear that Omoding has left. Yes, it is academy which is going to do the monitoring of these fellowships in UCI, and the other people who are going to start the fellowships, so that we really know that the people whom you said that they are here, Kivude is here, and the people are training, because you don't want to bring people at the end, they are here spending time, and the trainers have left. So we are calling before that academy comes for self-discipline and regulation, so that council doesn't come and say, oh, now we are going to examine your fellows and whatever, which we don't want to go to. So the people who are gazetted here to train, they must be here. If there are problems, the council should know and what you have done about it.
UCI TV.
Dental Practitioners Council visiting the Uganda Cancer Institute, really for inspection purposes, to determine if the institute is suitable for training cancer specialists. We as the Uganda Cancer Institute have built the facilities to train cancer specialists, and the Medical Council, and the law that was passed in 2018, was trying to ascertain if we have the capacity. And the importance of training people locally is that we can train many more people and train them at a much cheaper rate, really to provide the human resource that is needed to meet the growing demand for cancer services in the country. We're establishing 4 regional cancer centers. The Cancer Institute in Mulago is growing, and we need specialized human resource to take care of these patients. And that's really what the Medical Council is determining, if we have the capacity to do the training in this country. And so far, we have got very positive reviews, and we're hopeful that we'll be able to start the training and have our specialists trained locally and serve Ugandans. Thank you. Most specialists are trained is by training them locally. The specialists that we send abroad are very expensive to train. And if you're training people abroad, really you can't afford it, so you have to develop local training programs which can train many more people. The Medical Council approves Uganda Cancer Institute as a training site to train cancer specialists.
UCI TV.
The first question about what will come out of this. This is the Medical and Dental Practitioners Council. What we expect them after this visit is to make a decision whether we are actually capable of mounting what we call training programs or fellowship programs of good quality. And this is to produce specialists in the treatment of cancer. So we expect after this visit they'll go sit down and make a decision whether we meet the requirement or we don't meet the requirement. In any case, I think from the visit, I think they have been very impressed with the things that they have seen. So that is number one. Number two, we need these experts in order to be able to provide the necessary specialists that will now treat the many patients that you are seeing. So the many patients mean we need also many experts in order to handle them. And then number three, of course, once now we have the experts who can provide the treatment for the many patients that we have, then there is need for government now to give us more money, because that means we are going to even be getting more patients coming, because now they know that the people to treat them are being locally produced, that the numbers are many, so there is no need for anybody now to stay behind without coming here to get treatment. So that means we need now to increase the budget to kind of be able to rhyme with the number of services that we are providing and the number of the experts that we are having and the many patients that are coming.
UCI TV.
Okay, amanya Dr. Katumba Sentongo Gubala, nze senkulu w'ekitongole kya gavumenti ekirabirira omutindo kusoma n'enkola y'abadokita mu Uganda. Tuzze wano mu Cancer Institute kubanga baweebwa obuvunaanyizibwa obulala okulaba nti abakugu abasobola okusoma mu specializations zetulina wano mu Uganda tubalabirira. So ekituleese wano okulaba nti Cancer Institute eyina obusobozi obw'abasomesa n'ebyuma n'abawadde abawera okulaba nti basobola okusomesa abakugu abajja okutujjanjaba wano mu kansa, ng'ekigendererwa kyonna kulaba nti abalwadde baffe wano mu Uganda ne mu East African Community tebakyagenda India, South Africa oba Bulaaya, nga bonna tubajjanjabira wano. N'olwekyo pulogulaamu eno ezze kukola kukakasa oba ekitongole kino kiina, neera komiti erabye nti waliwo abasomesa abamala, abalwadde abamala n'ebyuma ebimala. So tulowooza nti ekitongole ekya Uganda Medical and Dental Council kijja kuyisa Uganda Cancer Institute ng'essomero ly'abakugu abajjanjaba kansa si mu Uganda yokka naye ne mu East African Community. Abalwadde bangi nnyo naye batulaze ebizimbe bibazimba bibasuubira nti bijja kulongoosa ku mbeera eyo. Ekyo kukyali kusoomooza kw'amaanyi. Ekyokubiri nti ebyuma gavumenti ekyagula nti abalwadde abalinda obujjanjabi nabo bakyali bangi. Ani batuwadde pulaani etutegeeza ebyuma bibagenda okuleeta ne bibagenda obiteeka. Tulowooza nti okulwisa oba okulwisibwa abalwadde kwe babaddeko kujja kukendeera ddala. Kusaasaanya obujjanjabi okugenda eggulu, Mbale n'embalala bafune ssente ezo, abalwadde bagaane kwetuumanga wano kubanga bava wala, oluusi bafunirawo n'obuzibu mu ntambula naki. So naffe tujja kwegattako eddoboozi okubasabira ensimbi. Okay, Dr. Katumba Ssentongo Gubala, ye ssenkulu w'ekitongole ekya gavumenti ekyerabirira ensoma, enkola n'empisa mu ggwanga Uganda Medical and Dental Council.
UCI TV.